here I am, all ready for my patient care tech training. Ain't I cute? I'm so excited, so excited. Here's a bed. This is what a patient bed looks like. This is what they show us. Isn't that nice? Can't wait. Can't wait to get started with all of this. Just looking here around, coming inside, they let me get a sneak peek of what we'll be studying today and what we will be learning. There's the dummy we'll be working with. This is a big scan. There's some supplies and things on the table. I have no idea just yet what they are, but I know I will find. Ooh, I know I will soon find out what they are. I can't wait to find out what all of these things are for, what we will use them for. Okay. All right. Didn't expect that. Don't let your kids watch this video, guys. But yeah, so I'm just looking at everything. I can't wait to find out more about. Wait a minute. What in the world? I can't wait to find out about more about this stuff. I'm kind of nervous. Okay. Yeah. So, of course, everyone knows you're going to deal with anatomical parts and pieces, but I didn't know that this is what the models would look like. Like, I've never done anything besides shadow doctors when I was in high school because I wanted to be a doctor. But this is so exciting. Here, this is something that we actually got to play with. So this is day 2. So the first day you saw me looking at all the stuff, and this is day 2 where we learned about the boot, and we get to put the boot on and put it on one another and ourselves so we can actually see how you will do that if there's a patient. Now, this is very interesting. These are the electrode things that you put on people to monitor their heart. And so we had to learn what color goes where, guys, because you can't just put these things on anywhere like most of you may think. So look at the colors here. All right. And there's a trick to remembering. I won't tell you. You must subscribe for that one. Ha ha ha. But just see if you can figure it out. Some of you already know because some of you are in the medical field. Now, here's the bedpans. This part was, let's say, kind of interesting because I didn't know they had different sizes and that they had different functions. So we went into the room to learn about the different sizes and functions. And here is our model again, our dummy here, that we learn how to do things with. So here I'm just showing you what it's like to kind of put a bedpan on. Now, of course, they will not have on pants when you're doing this, but this is just me practicing, making sure I have it facing the right way, trying to make sure like their buttocks are on there. It's tricky, guys. It's not easy. Now, think this is just a fake person. A real person is heavy. Okay. This was my favorite part. Learning here about the blood pressure cuffs and how to use the thermometer here. I've always wanted to do this, so I'm just going to do it here. You know how you always see the nurse push the little thing in, and they do it so quickly, and then they take your temp and push it right in the trash. That I love that. So yeah, there's different size cuffs for different arms. So I think I knew that, but I didn't give it too much thought any of the times that I or my children had to go to the hospital or anything. You know how emergencies may happen when you have young ones, but that's the baby one right there. And it's very tiny, and it's so, I don't know if I should say cute because it's not cute to have to be in the hospital, but you know, if you're into the medical stuff, things kind of look interesting and cute for you. That's child size, that blue one there. And they're just in order. Our instructor did tell us it may not look like this when you're in the room. You may not have all of these. Guess what? Look at that. Can you see it? It's upside down. Oops, I didn't realize that. But that's to white. That what I just showed you was a Foley No, this is a Foley, but what I just showed you was the wipes that you will use when you're changing this out. So this is day 3, and I'm actually learning about this stuff now, so I can go into a little bit of detail. This is supposed to look like urine. So this is what people will actually have connected inside of their areas where they urinate. I'm trying to say this is clean just in case your child finds it. And this is what it actually looks like on the inside. So you just saw what's hanging on the outside, but on the inside, that's what it looks like. All right, these are the connections, making sure that, you know, that it has to be locked so urine won't go everywhere and that it's connected and to the bed. And here's a kit here. I forget what they told us about it, but I know it's supposed to help with brushing teeth easier, because it can like suction as you brush teeth. And I think I'll understand this better once I actually get a chance to use it. But yeah, I thought it was kind of cool. So I guess some people can't form their mouth to spit. Maybe they're older, or maybe something's wrong with their muscle or jaw. But that's really cool. Now this, guys, I never even knew about this stuff before, that people had these bags on them. But yeah, you know what this is. And this is just another model to show if there was a Foley inside. Here I am getting a chance to actually see if I can utilize what's here. And we had to learn how to take the catheters out. So here I am, just looking pleased at what I'm learning. And this is so cool, guys. So this is actually how you do a sample, you know, a urine sample. Okay, moving on and looking there again at the catheter once it's pulled out. That's what that was showing you. That's basically some more stuff, some more supplies here. And this, guys, I've never heard of this either. Apparently, this is like a suction you can put at the genital area, and it sucks the urine out without them, I don't know, having to wear a diaper. So this is where you put all the sharp stuff. And this, guys, ugh, I feel bad about people having to do this. This is like some stuff to thicken up any drink, or even maybe something thicker like applesauce, because some people need to have something thick. They can't drink regular thin consistency, or even applesauce, which is a thicker consistency. They can't even tolerate that. So this is the cool thing about patient care training, is you get to actually try things. So we all had to stir this up and taste it. Ugh, it wasn't good. It wasn't good. Here's just showing some more things we had to learn how to use, why we got to use a face shield and some dentures. And it's very important to check this, because some people need that to eat and they may not tell you. Here are some glasses, and we're just learning care. Make sure we clean them. Like if you see somebody with some dirty glasses, don't just talk to them and not do anything with their glasses. So look how this applesauce is. After adding the thickness stuff to it. Here are some more materials that we had in class. Self-explanatory. We even went in the restroom and talked about brushing teeth and colonoscopies, and we got to put a bag on. As you can see, here I am. Just even though there's nothing in the bag, just so we can kind of see where it goes and what it might be like. So again, I can't imagine having to change one of these things. Yeah, but that's just life for some people. And as a nurse, pre-nurse, CNA, patient care tech, you got to learn that stuff. So again, here's back to that Purewig thing. It's just very interesting. And some wipes here. You actually clean people up without using soap. All right, just more materials here. Again, some of this stuff I'm pretty sure will make more sense once I actually start using them. And I'll probably make a different video after I figure out some of this stuff. So here's what it looks like. They're telling us to empty that colonoscopy bag, the urine one as well. And then here again, this is when you empty the Foley, it goes into that cup. Again, this was fun. One of my favorite things to do here is push the little device on to get the urine to come up. Yeah, I thought that was cool. Some syringes here, and just again, you have to make sure you dilute the bubble that's in there to before you take the catheter out. So again, I'm just showing more items here of where things belong, what they belong on, simulating what it may look like in a patient's room. So this hand sanitizer, guys, we have to squirt on our hand before we come in and squirt on our hand after we come out, like when we leave the room, or we will get in trouble is what they're telling us. So here we are in a different room with a different dummy, and this room we had to find objects that shouldn't be in the bed with this person. So it's kind of like a little scavenger hunt, and we actually did it in teams and we got to see who won and who didn't, or who found the most, I should say. But yeah, we had to learn how to use these to kind of restrain a patient, which kind of was scary to me. I'm like, wait, we get to restrain patients? Not with the handcuffs. We are not allowed to do that. Only if they come in with the authorities. The authorities are in control of that. We have nothing to do with the handcuffs. But they wanted to put that there to remind us, never do we touch those. If we see those on a patient, the authorities they're doing something with that. Bed alarms are interesting because they said people like to get up and wander or get up when they shouldn't. I guess I can get that, but I'm kind of curious of how that's going to work with a real person as well. Here I am here looking again at this bag that's on me because we did have it on us the whole day, guys. This was super cool. Now, if you love medical stuff and you're just now getting into it, taking out an IV is going to feel like awesome. So I wanted to take a picture here with me and the arm because I'm like, this feels so real, like medical. I'm in here, guys. Here's me and a colleague, a friend, someone that I just met actually. Also training. That's the end, guys. Hope you enjoyed.